Hello guys, I hope you're well. So today I wanted to go through budesonide and the importance of understanding the use of budesonide for the upcoming Gphc June exam. So budesonide is a drug that is used in many different situations. It can be used in asthma, it can be used in other sort of respiratory conditions as well. Now budesonide is an inhaled ICS, so inhaled corticosteroids, and it's mainly found in LABA ICS combinations. So it's used in, for example, Symbicort Turbohaler, for example, is an example. And this is important to understand. So budesonide can be used in prophylaxis of mild to moderate asthma, it can be used in prophylaxis of asthma, and it can be used in allergic rhinitis and other issues. Now, that's not really the important thing to discuss today. We need to understand that with corticosteroids, even though budesonide is an inhaled corticosteroid, it can still cause central sinus chorioretinopathy, and that's the ocular issues that you see with corticosteroids. Also, they need to still have a steroid emergency card with them, and the same principle applies. You would avoid live virus vaccines with budesonide because it still is a corticosteroid. Now, a caution is avoid after nasal surgery until healing has occurred when given budesonide. You have X-ray changes when it comes to all corticosteroids, so frequent monitoring of X-ray changes should be done with all corticosteroids systemically. You have pneumonia in patients with COPD, you have anxiety with corticosteroids, candidiasis. The risk of oral candidiasis can be reduced by using a spacer device with the corticosteroid inhaler. Rinsing the mouth with water after inhalation of a dose may also be helpful. An antifungal oral suspension or oral gel can be used to treat oral candidiasis without discontinuing corticosteroid therapy. So the positive of giving antifungals with oral candidiasis is giving antifungals when a patient has oral candidiasis from corticosteroid therapy is that you don't need to discontinue corticosteroid treatment. That's why. So also we mentioned you can use a spacer to reduce the prevalence of oral candidiasis, and these are very, very important. Now with spacers, they are suitable for PMDIs but not DPIs. Also, you need to replace your spacer annually, and you need to wash it monthly with warm soapy water, not boiling water, and do not use a towel to dry it because it can lead to buildup of static. So if you withdraw a patient abruptly from corticosteroid therapy, you can cause adrenal suppression. So prolonged course of corticosteroids can increase susceptibility to infections, and patients taking corticosteroids should be advised to take particular care to avoid exposure to measles and seek immediate medical advice if exposure occurs. And thank you so much.